Have you ever wondered if fillers can actually increase penis size? Are they safe? Are they permanent? And more importantly, why are so many men today considering this type of treatment? Because if you search online, you will find a lot of promises. Clinics claiming amazing results, quick procedures, no surgery, minimal downtime. It sounds almost too good to be true. But here's the real question: what are they not telling you? Can fillers really give you a bigger penis? Or are there risks that most people don't fully understand? And if you are considering this treatment, what should you know before making a decision? Because in this video, I'm going to explain the truth about fillers for penis enlargement, not from theory, but from real clinical experience, including the complications that we see every single year in our practice. Stay with me until the end, because this is one of the most misunderstood treatments in male sexual health. Now, before we continue, let me quickly introduce myself. My name is Dr. César Noval. I'm a plastic surgeon specialized in male sexual health, penile enlargement, and gender affirmation surgery. We have clinics in Spain, Mexico, and Miami, where we treat patients from all over the world. Our main YouTube channel in Spanish, Clínica Nef, has more than 100,000 subscribers, and we created this English channel to bring high quality, evidence based medical information to a global audience. We are also using artificial intelligence to expand our educational content so we can reach more people and help more patients understand their options. Now, let's talk about fillers. First, what are fillers? When we talk about fillers for penis enlargement, we are usually referring to substances like hyaluronic acid. Hyaluronic acid is widely used in aesthetic medicine. It is commonly used in the face, for lips, cheeks, and other areas because it adds volume and can be injected relatively safely when used correctly. So the idea is simple. If you inject a filler under the skin of the penis, you can increase its thickness, not length, thickness. This is a very important distinction. Fillers do not increase the length of the penis, they increase girth. So, how is the procedure done? In most cases, the filler is injected under the skin of the penis, in the subcutaneous tissue. The goal is to distribute the product evenly around the shaft. The procedure is usually done under local anesthesia, and it can take between 30 minutes to 1 hour. At first glance, it seems simple, but this is where things start to get complicated. Let's talk about results. Yes, fillers can increase girth. Patients may see an increase in circumference, but the results are not always as predictable as many clinics suggest. Why? Because the penis is not like the face. The skin is different, the movement is different, the function is different, and most importantly, the penis is a dynamic organ. It changes constantly between flaccid and erect states. This makes filler behavior much more complex. One of the biggest issues with fillers is irregularity. If the product is not perfectly distributed, it can create lumps, asymmetries, uneven thickness, and this can be very noticeable, especially during erection. Now, let's talk about one of the most important problems: granulomas. Granulomas are inflammatory reactions. They can occur when the body reacts to the injected material. Even if the filler is considered safe, complications can still happen. And when they do, they can be very difficult to treat. In our clinic, every year, we treat many patients who come with complications after filler injections, patients who had procedures done elsewhere, and now have lumps, deformities, pain, irregular shapes, in some cases, even functional problems. This is not rare. This is something we see consistently. Another issue is migration. The filler does not always stay exactly where it was injected. It can move, it can accumulate in certain areas, and this can change the shape of the penis over time. Then we have resorption. Hyaluronic acid is not permanent. It is gradually absorbed by the body, so the results are temporary. This means that if a patient wants to maintain the effect, they need repeated treatments, more injections, more cost, more risk. Now, some people see this as an advantage because it is reversible, and in some cases that is true. Hyaluronic acid can be dissolved, but not always perfectly and not always easily, especially when there are complications. let's talk about something very important: expectations. Many patients come with unrealistic expectations. They expect dramatic changes, they expect perfection, they expect a completely natural result, and this is not always achievable. In reality, fillers can provide moderate increases in girth, but they also come with variability and potential complications. So, are fillers a good option? The answer is not black and white. In carefully selected patients and when performed by experienced professionals, they can be an option, but they are not risk-free and they are not a perfect solution. This is why proper evaluation is essential. Every patient is different, every anatomy is different, every expectation is different. Now, let's compare this with surgical options. Surgery is more invasive, but it can provide more stable and controlled results. On the other hand, fillers are less invasive, but less predictable. So the decision depends on the patient's goals, the anatomy, the expectations, and the level of risk they are willing to accept. One thing is very clear: there is no perfect solution. Every option has pros and cons. And this is why medical guidance is essential, because what you see online is often only the positive side, not the full reality. So, what is my final advice? If you are considering fillers for penis enlargement, inform yourself properly, understand the risks, choose experienced professionals, and most importantly, have realistic expectations. Because your goal should not just be size, it should be function, safety, and long term satisfaction. If you found this video useful, make sure to subscribe, because we will continue sharing real, evidence-based information about male sexual health. And if you have questions, leave them in the comments. I'll see you in the next video.